we've talked about here today. Now we're going to take a look at concussions, which are oftentimes much more challenging to recognize. A common misconception regarding concussions is that consciousness is lost, which doesn't have to occur. So always remember that a child can suffer a concussion without being knocked out, which puts the youngster at an increased risk of furthering brain injury if the condition goes unrecognized and he or she continues to play. So keep the following symptoms in mind that Dr. Guskowitz discusses here today. And when you're looking at it and evaluating it, keep in mind that a concussion may have occurred.
There are many other signs and symptoms of concussion than just headache. Blurred vision, dizziness, balance problems, cognitive impairment or altered mental state, as we describe it, so difficulties thinking, remembering things. Those are very common following concussion, and it's very important that the athlete can report those things if they're experiencing them, because oftentimes the parent or the coach can't identify them even by just having a conversation with them.
Now, while some of the injuries we've covered are simply unavoidable and will occur from time to time due to the nature of sports, some others can be prevented, or at least their severity lessened through warming up and conditioning your young athletes. If you played sports yourself while growing up, just hearing the word conditioning may have you cringing in your seats right now. That's probably because you have memories of running endless laps around the field, and you know how boring that was. When you're conditioning your players, your best approach is to incorporate it into your practice rather than designating a segment of your practice strictly for conditioning. Remember what you heard earlier. Practices must be fun and engaging. The minute they become boring or repetitive, kids lose interest. First, we'll listen to what Coach Harbaugh has to say regarding conditioning, and then we'll check in with Dr. Gray to hear some specific do's and don'ts on conditioning kids.
To me, everything is a game. We do it with our guys here. We do it in our conditioning program. We make up games where they've got to do constant running, and it might be barrel ball. So you set up a barrel, and it's kind of like soccer, but they run, they pass each other on the run, they throw it in the barrel. So set up a game where there's constant running, yet if there's one of the children might not be in as good a shape, if they have to slow down a little bit on the side, that's okay, then they can pick it back up. But it's time flies like that if they're having fun and they're moving the whole time. If you set up a youth activity and they're not moving the whole time in some way or another, I think you haven't done a good job.
One of the questions coaches often ask is, what do I do to condition my kids before the season or before practice? Because I don't know if Johnny or Sally, who's coming to my practice, is highly conditioned, is average conditioned, or is totally deconditioned. What I usually recommend to coaches in a situation like that, set up a basic conditioning program, assuming all of the kids are not conditioned at all. The kids who are highly conditioned, that won't hurt them. They can still go through the conditioning program, and that way your kids who are moderately conditioned or totally deconditioned can gradually get into shape so that they're not injured. What you don't want to do, coaches, don't overkill your kids. Don't start them at too high of a level. Start them low and gradually increase.
That's really some great insight. And you know what? Stretching is another one of those areas that kids may not pay much attention to, but that you must. Let's listen to what Dr. Gray has to say regarding the importance of stretching and how it should be incorporated into your practices pre- and post-game activities.
All right, let's talk about an area of a little bit of controversy, and that's warm-up and cool-down. Many coaches are aware of the fact that it is important to warm athletes, but keep in mind of the age of the athletes you're dealing with. Very young athletes are extremely flexible, and they don't need the same amount of stretching that you might need or I might need. But when we talk about warming our athletes up, it's not just a one-phase program of stretching. Warming up consists of two phases, coaches. The first phase is you've got to imitate what you're about to do. In other words, if your kids are going to be running, let's say it's a soccer game, then they need to do some light running or jogging to warm those muscles up. If they're going to be doing baseball, it's totally different, where they're doing a lot of throwing. So you want to make sure you incorporate that imitative activity into the warm-up program. So once you have warmed them up, now the muscles are ready to be stretched. And again, we run into some controversy here. Do we do dynamic or passive, static or passive stretching, or do we do dynamic or ballistic stretching? Ballistic is a little quicker, a little more dangerous. Passive or static is slower. What I would recommend you do slow passive stretching, getting the muscle attuned to what it's about to do, and then maybe the last 2 repetitions right before they go into practice or on the field would be a little more dynamic in nature, a little quicker, a little more rapid, simply because that's what they're about to do. But again, back to my earlier point, these are young kids, very flexible. They don't need extensive stretching. It needs to be imitative activity and just basically full range of motion movement. The key also is that you're teaching these young people that later in life, when they begin to lose flexibility, which we know happens, they'll still need to do stretching, and you're almost teaching them to be aware of that fact. So keep in mind two things: imitative activity and some slow stretching, then just gradual slight increase in speed right before they do the activity. Cool down is a period in which we try to bring things back to normal. That's what you have to keep in mind. There's several ways you can do that. A trick that I used to like to do when I was coaching was to move my practice sessions away from where the cars were parked of the parents, and when practice was over, the kids had to walk to the cars. Well, that's an excellent cool down period. Any trick like that you can use, where the kids have to walk, go to wherever they're trying to go, but they're doing it slowly, so they're bringing all systems back down to normal. That's what cool down is all about.
We also want to stress the importance of being trained in CPR. If a child on your team or the